Today, I am going to be talking about something very specific, and that thing is Vitex. So Vitex is something that I have talked about a lot on Instagram. If you follow me over there, then you may have seen my Vitex highlight, a lot of the Vitex stories that I have sent to me, and my own personal testimonial from using Vitex. So there are a couple of uses for Vitex, which is an herb. I'll tell you about it in just a minute. But today I'm going to be talking about one use in particular, and that is using Vitex for infertility. So even if you are not trying to conceive or you don't have a personal interest in infertility, I guarantee you know somebody who has been affected by infertility. It is becoming just more and more common all the time. The statistics are insane. I just saw something yesterday that sperm count, so this is not just a women's issue. I think for a while we thought, for a few decades with infertility on the rise, we thought it was just women. No, it's men too. It's equally affecting men and women. I just saw something that sperm count is declining like 2.5% every year or every couple of years, but do the math there, over 20 to 30 years. That's not good. That's not good. There's actually a book called The Countdown, I think, that talks about declining sperm rates in men. But anyway, I don't have to tell you guys this. You know that infertility is a huge thing that so many couples these days do face. So that's what I'm going to be talking about, is using this little herb that I have here in capsules for treating infertility. Now, Vitex is an herb. It's Vitex agnus cactus is the actual name. It comes from the chaste tree, chaste as in chastity. So I'll explain why it's called that in a minute here. I just get this brand here. This is called Nature's Way. It's very cheap. This bottle was like 15 bucks, but I'm not even going to link it because I Googled it before I made this video and I found it for as cheap as $6. So this herb, the tree gets its name, chaste tree, because supposedly long ago, monks would actually consume Vitex to lower their libido and make it easier for them to keep their vows of celibacy. So you might be thinking, wait a second, if this lowers libido, then how would it balance hormones? How would that help me get pregnant or be fertile? Because low libido usually is kind of one symptom. It can be a symptom of infertility. So I will explain all of that. But first, let's talk about the kinds of infertility. So in this video, I'm just going to be talking about female infertility. If you want to learn more about male factor infertility, which like I said, in 50% of cases, around 50%, that's what it is. It's male factor. So we can't just assume that it's the woman. It could very well be the man. But when it is the woman, it can be a couple of different things. So it could be, I would say this is more rare, but it could be anatomical. It could be that the woman has some kind of uterine condition or some kind of blockage in her fallopian tubes, something actually with her anatomy that is preventing her from ovulating or preventing sperm from meeting egg or preventing an egg from implanting and an embryo from implanting in the uterus. Not going to go into depth on that, but you can just look up different anatomical problems that could be preventing a woman from getting pregnant. I'm not going to talk about that today because if you have an anatomical problem, nothing is going to help aside from potentially having some kind of surgery or something to correct that problem. However, the other problem that women deal with when experiencing infertility is hormonal imbalance. So most of the time, if infertility is not due to some kind of anatomical problem, it's because of hormonal imbalance. So that's what we're going to talk about today. Fertility is totally dependent on hormonal balance. So every single month there is a very intricate hormonal process that needs to occur inside of a woman's body in order to ovulate I'm not going to go through all the terminology here. If you guys don't know basic fertility terminology, I would just encourage you to look that up. This video is geared more towards someone who maybe has been experiencing infertility, so knows all of this terminology. But the hormonal process that is necessary for ovulation to occur, like I said, it's just very intricate. A lot of things need to happen, and it's not just isolated to our reproductive organs. A lot of it is here in the brain. So when we think about infertility, we just want to, in Western medicine, we want to isolate everything and think, oh, well, it's just this one little section of my body, my area where my reproductive organs are, that's for some reason not working right. But actually, we need to look at the whole body, especially the brain. So when a woman is experiencing hormonal imbalance, it could be something in her environment, it could be some stressor. A lot of times it's usually work or life stress. It could be, gosh, just so many environmental things. And although we are very resilient, we wouldn't have made it this long in human history if we weren't, it actually doesn't take that much to upset that hormonal balance enough to tell the body, hey, it's not safe to carry a baby right now, so things are gonna be thrown off. And the older we get, the easier it seems that it is for that hormonal balance to be thrown off. So I know in my case, when I was in my early 20s, I did not have to think about getting pregnant. I didn't have to try to get pregnant. I just got pregnant. It was very easy. And I, like most people, assumed that it would be like that my whole life. I thought, wow, if we don't prevent, we're gonna have 20 kids. Well, that's pretty presumptuous. Usually for most women, like I said, I know there are exceptions. I have friends who are in their mid to late 30s and have 10, 12, 15 kids, but you guys, this is rare. Because of my faith, pretty much all of my close friends don't use any kind of contraception, and that's not the average. Usually if you let things go, it's like 6, 8 kids, something like that. The average number of children per household going back 150, 200 years before contraception, and when we were largely a very Christian nation that practiced, different things differently morally, the average was 8 children per household. So 20 kids just isn't the average, because as we age, normally fertility does slow down. So fertility for women peaks in the 20s and then just kind of slowly slows down usually. This happened for me. I had my first 3 kids, very easy, back to back to back. And then our story is that my husband got a vasectomy. This is not something where I'm gonna go into detail on why that happened or all of our conversations around that, but I have shared that he did get a vasectomy, and then 5 years later, he got it reversed. Yes, you can do that. Vasectomy reversal is a thing. So by the time he got it reversed, I was in my 30s, and I just assumed I am going to get pregnant, no problem. I never had a problem before, so I'm not going to have a problem now. Well, I was wrong. He got the reversal, everything went great, and it actually, the year mark rolled around. I thought I was gonna get pregnant right away. I thought, he'll recover from this and I'll be pregnant immediately. Well, a year went by and I still wasn't pregnant. Lo and behold, it was me. My hormones had gotten out of balance and I had become infertile. I was experiencing secondary infertility. But by using charting my cycles, using the symptothermal method, meaning you're tracking several different signs in your body, your temperature, cervical fluid, cervical position. So I use that charting method. And the first month I was able to identify what was going on. I had a short second half of my cycle, what's called the luteal phase. I had a short luteal phase. Looked like I had low progesterone. And these things are just really common in a lot of women who are experiencing infertility. Usually if you go to a fertility specialist, they're going to put you on progesterone first. And if that doesn't work, then it'll probably get more and more and more invasive. But the problem there is that's not addressing what's going on in the brain and the rest of the body. It's just trying to locally treat the infertility. So that's why you see a lot of women having to go all the way to IVF and then even struggling through IVF, like IVF not working. It's because we're not fixing getting to the root of the problem. So thankfully, I'm very plugged into, the natural community, and I was telling some of my friends what I had discovered. You know, they knew our journey. They knew we had gotten the vasectomy reversal. They knew it had been a year that we've been trying, and I told them I figured it out. I'm ovulating very late in my cycle. My luteal phase is really short, and I think I have low progesterone. I just don't know what I'm going to do. And my friends were like, well, we know. You're gonna take Vitex, and it's gonna work, and it's gonna work really quickly. And I was pretty skeptical, but I was like, okay. So they started explaining the science behind it, and I tried it. You guys, within 3 months, I was pregnant, and I continued charting while I was taking Vitex, and I could see my cycle improving every single month. It is so effective. And you know, now that I've had this experience, I've talked to a lot of women who have used Vitex to conceive several babies. Vitex is so effective because it works on the pituitary in the brain to increase dopamine activity and balance progesterone and estrogen. Most women these days are estrogen dominant due to environmental factors. You guys can look into that. That's kind of becoming widely known. One thing that really contributes to that is past birth control use. So if you have a history of birth control use, you probably have some estrogen dominance. But anyway, it works on the brain. That's why it's so effective at balancing our hormones. So Vitex is really good to pair with like a natural bioidentical topical progesterone. Okay, not the pharmaceutical synthetic stuff, a good bioidentical. I'll link the one I use in the description below because the Vitex is priming your brain, and actually you don't need to use a topical progesterone. I've done it both ways, with and without. So you can totally just do the Vitex, and if you identify that hormonal imbalance is your problem, it's probably going to work. It's just so effective. I've been sharing about this for a few years now, and I've just gotten so many testimonials. But if you want to try the topical progesterone too, then that's great. So if you're charting, you will see, as soon as you start taking Vitex, you'll see your luteal phase start lengthening. You might even see your temperatures rise, showing like some improved thyroid health. It's amazing. You're going to be ovulating a little bit earlier. It's priming your body to get pregnant and stay pregnant. Earlier, I said I would explain why monks used to take Vitex to lower their libido, and I forgot to explain it, so let me stop and explain that now. Vitex works great for bringing hormones into balance when you have a pre-existing imbalance. However, if you don't, so if you are hormonally healthy, like you have a perfect chart, you're ovulating on time, everything looks great, Vitex is actually going to have the opposite effect. It's going to throw your hormones out of balance, lower your libido. It could cause depression and PMS symptoms. This is why it's really important to chart before you take Vitex. It doesn't take much charting, just one cycle to identify if you have a problem. And if you don't have a problem, Vitex is not for you. I would look into checking to make sure there's not some kind of anatomical problem. Now, one really popular use for Vitex is when a woman is breastfeeding and wants to get pregnant without weaning. I would not recommend doing this before the baby is 1, because if you're not fertile and the baby's not even 1 year old yet, that's fine. That's just your body kind of taking its time to return to normal. But if your baby's old enough to where if you got pregnant, your supply dried up, and the baby was weaned, it would be just fine, and you want to get pregnant, then absolutely go for it. So Vitex also lowers prolactin, which is higher when we're breastfeeding, and that's one thing that can prevent the cycle from returning and prevent ovulation from occurring at the time that it should. So Vitex is going to lower prolactin and help breastfeeding mothers conceive. And you know, it could potentially lower your supply. That has not been my experience. Women that I've talked to who are breastfeeding and want to conceive, when they start taking Vitex, it doesn't affect their supply. If anything affects their supply, it's actually getting pregnant, because some women just dry up during pregnancy. That's just how it is for some women. I know, like, okay, my sister and I, we live a very similar lifestyle. We're built just alike. She can nurse all the way through pregnancy and tandem nurse. I dry up at 6 months every time. I don't know why. Like I said, we eat a lot of the same foods. We live the same lifestyle. It's just the way that God made some of us. I would love to nurse all through pregnancy. I just can't. So that's one really common use for Vitex is just getting pregnant when you're nursing and you haven't gotten your cycle back, or maybe you're breastfeeding, you've gotten your cycle back, but you've got the luteal phase defect, so you're just not fertile, you're having infertile cycles. Now, one thing that comes along with that, when you have hormonal imbalance that is causing infertility, infertility isn't like the only symptom you're having. Hormonal imbalance affects everything. So you're probably experiencing fatigue, you might be experiencing really bad PMS, maybe even PMDD in your luteal phase. You probably got other symptoms. So that's another reason that a lot of people take Vitex. In fact, on the bottle here, it just says traditional support for female monthly cycle. It's not necessarily marketed to address infertility. A lot of women just take it to treat severe PMS, which it's very effective because it balances hormones. And the instructions on the bottle here are for taking it for treatment of PMS. But I'm gonna give you different instructions because when you take Vitex to treat infertility, it's a little bit different. What you wanna do is take, let's see, these are 400 milligrams in one capsule. So you wanna take a total of 800 milligrams every morning. That's 2 capsules if you do this brand, okay? 800 milligrams every morning, first thing when you wake up, at least 30 minutes before you eat. So just a glass of water, your 2 Vitex capsules every morning. Do that, chart your cycles, and you will see your luteal phase lengthen. You'll be ovulating earlier, your chart will start to look beautiful, you'll get that good temp shift. If this is all sounding like crazy language, go get the book, Taking Charge of Your Fertility, and that will explain charting. Charting is fabulous, and it just breaks my heart that fertility doctors, I don't want to lump them all in the same category, but most fertility specialists don't even know what charting is, and it's like the first step to addressing female hormonal infertility. But anyway, that's what you do. You just take 2 capsules every morning and keep taking them. Within, usually, I think there's actually been a study that said it takes on average 3 months to totally regulate the cycle, and that has rang true for me. The first time that I used Vitex to conceive, after the vasectomy reversal, it took 3 cycles for my cycle to regulate, and I got pregnant, and I stayed pregnant. And I'm actually taking Vitex again, and it's working. My charts reflect it. It's working like a charm, like it always does. I have friends who so I have one friend who's got 7 or 8 kids, and the first 2 were conceived fine, no problem getting pregnant, and then she experienced secondary infertility. Every child since then, she has had to take Vitex to get pregnant, and it works every time. So now what happens if you get pregnant while taking Vitex? Do you continue it? Do you stop it? You'll get mixed reviews if you look online, but I've been around the block. Let me tell you the protocol that's recommended by midwives. This is what you do. You want to continue taking it because it helped you get pregnant by increasing your progesterone. And in the first trimester, your progesterone production is not coming from the baby's placenta. It's coming from the corpus luteum. Look that up if you don't know what it means. And then in the second trimester, the placenta kind of takes over a lot of the hormonal process. So in the first trimester, just continue taking the Vitex to kind of help your body out. You know, I'm not saying that going off Vitex would for sure cause a miscarriage, but it's not going to hurt anything to continue taking it. This is what I do. I take it all the way up to 12 weeks, the same way I took it to get pregnant, 2 capsules in the morning. And then on week 12, I go down to 2 capsules one morning and then 1 capsule the next, kind of alternate for a week. And then the next week, you do every other day, 1 capsule, then no capsules. That's like week 13 of pregnancy. Then week 14, you're done. You're weaned off the Vitex, you weaned off slowly, and you're done. And then you go on and enjoy your pregnancy, and that is it. That is how you use Vitex to treat female factor infertility that is caused by hormonal imbalance. Disclaimer, I am not an herbalist, I'm not a doctor, I'm not a licensed healthcare provider of any kind, and I don't have the time or ability to do any kind of one-on-one counseling, But if you have any questions or comments, feel free to drop them below. And if it's something pretty basic and I've seen a resource I can send your way, I absolutely will. But at the end of the day, you're just gonna have to use your own discretion and consider maybe any other meds you're taking or herbs you're using. All right, well that's it for this week's video, and I hope this was helpful, or if not helpful directly to your situation or applicable to you, then maybe you just learned something new that you could potentially share with somebody someday.